There's a running joke about hospitals in Nevada. So where do you go for great healthcare in Las Vegas? The airport. But for the Las Vegas Sun, this was no joke. Until the Las Vegas Sun discovered nearly 4,000 cases of hospital patients who suffered preventable injuries, infections, and surgical mishaps, including 365 in which the patients died. Nobody in Nevada, not government regulators, not hospital administrators, not doctors, knew the risk that patients faced of being harmed when they sought healing in Las Vegas. Nearly 2.5 years of research, resulting in a 6-month Las Vegas Sun series entitled Do No Harm, changed the face of not only hospital care in Nevada, but helped flip the entire healthcare power structure in favor of patients. The newspaper stepped in where the government hadn't, by imposing transparency on hospitals and giving voice to patients who'd been powerless in defending themselves. From the moment planning began on the project, digital presentation and internet-specific content development were key. The way the Do No Harm series would commit journalism on the Las Vegas Sun's website was going to be an essential part of the storytelling process. The Sun's commitment to pushing the envelope with interactive narratives was noticed by not only readers across Nevada, but by journalism organizations throughout the nation and world. When Do No Harm won the Goldsmith Prize for Investigative Journalism, sponsored by Harvard University's Shorenstein Center on the Press, Politics, and Public Policy, Harvard officials noted the hugely collaborative multimedia series represented the power of teaming high-quality investigative journalism with imaginative and elegant multimedia representation. They even called Do No Harm the future of news. After the first 2 parts of the Do No Harm series were published, Columbia Journalism Review noted this is exactly what journalism is supposed to do. When the first part of the series was published in June of 2010, the website that accompanied the nearly 6,000 words in the print edition of the Las Vegas Sun set the tone for an unprecedented local reporting effort that would raise the bar on transparency, audience interactivity, and multimedia efforts by a local news organization. From the moment a reader first visits the Do No Harm website, it becomes obvious that this is not business as usual. The first part of the series focused on preventable injuries. The amount of data and research behind the journalism was staggering. Sun healthcare reporter Marshall Allen and computer-assisted reporter Alex Richards had filed public records requests that went back more than a decade, resulting in more than 2.9 million records. Allen then coupled those findings with interviews with more than 250 patients and hospital insiders to give the numbers a meaningful face. We don't know of any other news outlet, government agency, or organization in the country that has attempted a similarly comprehensive, data-based, and patient-centered report on hospitals hurting their patients. In an effort to make all of that information less overwhelming and more meaningful, the Sun wanted to find ways to not only make all of its findings easily understandable, but strikingly human. And that's where the storytelling elements of the web became central. Some things were as simple as a basic but helpful glossary, or an easy-to-understand look at the preventable injury data across Las Vegas hospitals presented in chart form. But interactive graphics that were as easy to use as simply selecting a category made all of that 2.5 years of research now seem astonishingly easy to understand. With each part of the series, the Sun produced video vignettes of select patients. Sun reporter Marshall Allen also conducted group interviews in the Sun's newsroom studio. Some of these interview videos were up to 45 minutes in length, and much to the surprise of even those who helped produce the videos, they were not only watched, but were watched for the longest average time of any video previously posted on the Sun's website. Marshall also went on local television to discuss the project and was on local public radio stations to discuss the Sun's findings. But more poignant was how the Sun's audience reacted. On the Do No Harm website, readers were asked if they would like to share their stories of hospital care in Nevada. The response was overwhelming. Hundreds of readers submitted their personal stories, with Allen calling each to talk with them and discuss their stories. And some of the reaction was even more organic than that. Though readers could contact Allen via email from LasVegasSun.com, nowhere on the website was his phone number. But his phone number was listed on the bottom of the print versions of these stories. The results of that were that Allen's voicemail box began to fill up with messages with stories from the Sun's readers. Some of those messages were then uploaded to the Do No Harm website.
I have a horrendous tale to tell you about hospitals, in reference to my wife.
But not all of the reaction was positive. Within a week of the series' debut, the CEO of the St. Rose Hospital Group in Las Vegas sent a letter to every Nevada legislator saying the Sun had grossly oversimplified hospital billing data, with the result being an inaccurate, incomplete, and negative view of hospital care in southern Nevada. A full-page ad was even taken out in the competitor to the Sun, denouncing the Do No Harm series. Yet shortly after that, the head of that exact hospital group had not only changed his mind about the Sun series, but had changed his hospital's policies on transparency. The St. Rose Hospital Group began to publicize the so-called Sentinel events it reports to the state. Sentinel events are unexpected injuries that require corrective plans. No hospital in Nevada had ever made them public before this.